the first case of HIV and AIDS in Botswana was diagnosed in an adult patient in the year 1985. It wasn't apparent then, but within a few years, the epidemic rose rapidly in the adult population. In the absence of ARVs and in the absence of therapies to prevent the transmission of the virus from mother to child, the epidemic in children began to parallel that in adult patients. So that in the mid-1990s, we noticed that the most important cause of admission to our hospitals and the most important cause of death in children had become HIV and AIDS. At that time, the therapies that were available before 2003 were essentially to manage the opportunistic infections affecting these children. We had no knowledge of how to use ARVs and until the first small clinic at Princess Marina Hospital was established with the help of BPI in 2001. The small clinic became the training ground for pediatricians and nurses in Botswana in the care of children with HIV and AIDS. And when the COE, or the Botswana Baylor Children's Clinical Center of Excellence, was opened in 2003, that was the first large-scale opportunity for children to be provided with comprehensive care and treatment.
This center means a lot to me and my son. It brought a lot of hope for us, because before the center was built, there was actually little being done for children. And when we saw the birth of this center, it was really a blessing for us, because with him coming here, growing up here, meeting with kids like him, interacting with kids like him, I'm sure it meant the world to him. Because when they are growing up and they don't really understand what is happening with them, but they see that, wherever they are going, it's a big family with other kids they hang around with. Because we try to explain what is happening with them being HIV positive. When they're still growing up, they don't understand that.
I enrolled in COE at 2005 because of my HIV status, and since then I've been part of Baylor. Baylor to me means everything that you can ever have. It's like my second home, which I can cry at, which I can find friends, which I can find parents to talk to, people to guide me and show me the right ways.
You raise me up so I can stand.
The COE has had many major successes. The first thing I would like to mention is that it has achieved excellent patient retention with a loss to follow-up rate of only 1.8. The other success is the fact that 10 years down the line, 92% of all the children in care have undetectable virus. That is, it cannot be detected in their bloodstream using the normal methods for looking for this virus in our laboratories. This is really excellent results. And we do not know of any clinic anywhere in our part of the world, or indeed in the rest of the world, that can beat that record. And so the children who are attending the clinic, and those that we can reach through our extensive outreach services throughout the country, are living and growing and becoming adults. And with the excellent PMTCT program that has been mounted by the Ministry of Health, we are seeing fewer and fewer children being infected with HIV at birth.
Raise me up to more than I can be.
Growing up in this center, I think it helped him and me a lot, because I don't know what would have become of us without the center. It has given us a lot of support. When he started his medications, that was before even any kids could access that. You know, they were just being on trials. And back then, we didn't really have much hope of what was going to become, you know, with a new disease and all that happening. But now we look back and look at the center today. It's amazing. I don't really have words for it, because it changed our lives and shaped our future in a way. Because now he's doing Form 1 and he's healthy just like any normal child. And coming here to him, I'm sure he also appreciates it, that it's doing a lot for him, really.
You raise me up so I can stand.
And that really was the main reason why we needed to construct an adolescent center at this point in time, to take care of the increasing number of children who have reached that age group and who have challenges that we were not prepared to address fully when the COE was opened in 2003. In time, I see us transitioning developing programs to transition these children into adult care, and to realign our services from the care of smaller children to older children. Also, in future, as we move forward, we will need to focus more on training and research, and in addressing other illnesses and conditions that affect the broader population of children in Botswana, rather than HIV and AIDS. It is my hope, my sincere hope, that HIV among children in this country will soon, within the next decade, become a thing of the past.
To more than I can be.
The Baylor Botswana Children's Clinical Center of Excellence, which opened in June 2003, was a landmark event. The success of the program has been replicated in centers of excellence in Lesotho, Swaziland, Malawi, Uganda, and Tanzania. These centers and this network of centers have been largely supported by the Bristol-Myers Squibb, and was made possible by the vision and commitment of Dr. Mark Klein, the president of BPI. The opening of the Adolescent Center is also a testament to the quality of care and treatment within the Botswana COE, and is in large part due to the strength and courage and perseverance of our children and adolescents being served in Botswana.
Looking forward, I want COE to provide us with the same services that they give us and everything else that they show us. I want them to guide us and care for us as they used to not change anything and just be the same. And also looking at the young ones that are coming behind us, I want them to provide them with the same support as they provided us with. Thank you.
more than I can be.
At this point of time, looking back at what has happened in the last 10 years, it is difficult to imagine that we would have achieved everything we have achieved without the tremendous amount of help we have received from a number of friends of Botswana. I would like to mention here first Bristol Myers Squibb, who provided the funds to construct the COE, and now the funds again to construct the Adolescent Center. I would like also to mention PEPFAR and CDC, who have contributed hugely to the fight against HIV/AIDS. I should not forget the political leadership that provided the right atmosphere for all these things to happen in Botswana, and especially the leadership of former President Phatsimong. I would also like to thank my colleagues, all those health professionals who have worked so hard to fight this battle, as well as all those caregivers who have worked very hard to ensure that the children get all the treatments that are prescribed to them on time, forgoing lots of their own pleasures and social activities to look after many of these children who are themselves orphaned. Thank you very much to you all.
You raise me